Dr. Vijaybhasker, Chairman, Ethics Committee, Clinical Research and Trials, Masters in Orthopedic. Today we are going to discuss about the low back pain. Why the people suffer from low back pain. There are a lot of reasons, lot of causes to know about the low back pain. Like low back is the consistency of 1, 2, 3, 4, 5 lumbar vertebrae and 5 sacral vertebrae. These vertebrae is associated or joined with the two facet joints each, and there is a disc in between two bones which act like a shock absorber. The central canal has the spinal cord. This is a yellowish color spinal cord where two nerves comes out either right and left through the foramina in vertebral bodies. So there is bone, vertebrae, discs, nerves, joints and ligaments around the bones and the muscles. So obviously, why there is a low back pain? There are many causes. The causes like bony problems like osteoporosis or bone tumors or bone infections, and there is a possibility of disc prolapse from the disc, and there is a discitis like tuberculosis, and there is a possibility of tumors in the nerves or spinal cord. There is a problems in the joints is called spondylitis, and there is a possibility of degeneration of the bone because of the deficiency of the vitamin D and calcium might lead to spondylosis due to the osteoporosis. And then there is a tuberculosis, there is a possibility of rheumatoid arthritis, there is a possibility of psoriatic arthritis, and there is a possibility of a arthritis which because of the bacterial infection and many other. So one which we must think commonly, there is a injury leads to compression fracture of the bone, lead to a damage to the nerve, a compression of the nerve. So likewise there are many causes for the low back pain. The most common cause we see in our practice is a disc prolapse, where the burst out of the disc leads to compression on the roots, either right side or left side or centrally caught, lead to low back pain and sciatica. So hence, when there is a disc prolapse, the disc prolapse appropriately in a stage 1, 2, we can treat with the rest, belt, physiotherapy and medicines, if necessary epidural injections. If there is a necessary, when the pressure on the root is stage 4, then we need to do a surgical decompression of the nerve or cord. So that is the one reason. Commonly we see a spondylitis, that is the inflammatory reaction at the fascial joints, which need to be given rest to the part with the cervical collar or the lumbar corset with the anti-inflammatory medicines and necessary some soothing or neurological relievers like gabapentin like medicines. When there is a osteoporosis, we should treat with vitamin D, calcium to recovery from the osteoporosis, which might not cause the trivial injury, wedge compression fractures in the older age. So apart from this, there is a spinal cord tumors where which can be diagnosed by MRI. In that MRI, when we see that the tumor is really causing pain, we should treat that tumor to be removed. Hence, what I would like to say is the spondylosis, where there is a osteoporosis leading to spondylosis, weakness in the bones, might require to treat with the appropriate medicines, vitamin D supplementation once in a week, and then daily sufficient requirement of the calcium, and then corset at the back, and then physical exercises, and then avoid any injuries falling from the bed or any other accidents. These are the caring we need to take in spondylosis. When there is a tumors in the bones, that tumor to be appropriately diagnosed with the CT scan and MRI. According to that tumor, we should treat it. And then there is a possibility of tuberculosis of the bone of the spine. That tuberculosis should be treated with anti-tuberculous treatment for 7 to 9 months. Apart from there is a localized abscess or there is a localized damage of the bone or disc that should be treated surgically. Dear friends, so what I would like to say is back pain is multi-cause pain. We must rule out accordingly and treat accordingly.